and educated about what we're doing here at Vail Healthspan. So today we're talking about heat and cold therapy, that sauna and cold plunge stuff. There's a ton of research and a ton of data behind this interesting and sometimes difficult technique. But this is a concept called hormesis that's doing difficult things to make you stronger and kind of functioning better as a complete biologic organism. Um, Again, there's a ton of research behind all this stuff, and we are happy to provide this research and papers. If you're interested in learning more about it, we're actually conducting a research subject here called the Chilled study that I am the principal investigator on. We're looking at sauna and cold plunge for depression and really fascinating stuff. So hormesis in longevity, again, that's doing hard things to make you better. Some of the science behind this stuff, we know that these things increase autophagy, that's clearing of zombie cells that are in your body that don't do anything anymore other than cause inflammation and stress. These things improve mitochondrial efficiency. We know you get anti-inflammatory and antioxidant defense from doing these hard things. This stuff affects you at the gene expression level and DNA level within all of your cells. AMPK and mTOR are these protein and metabolic pathways that lead to and kind of regulate aging. Nitric oxide production is improved and increased. That's your blood vessels' ability to relax and dilate. We know that these things help with ketogenesis and metabolic flexibility. That's kind of switching between fat metabolism and glucose metabolism throughout your day and during exercise and sleep and stuff. So sauna benefits, we know it improves cardiovascular function. There's several papers that show that sauna reduces all-cause mortality, sometimes up to 40%, enhanced insulin sensitivity and decreased risk of type 2 diabetes, lower inflammatory markers. We're measuring these things in our study, and lots of studies show improvement in inflammatory blood markers from sauna. Cold exposure, that's cold plunge, activates brown fat. That's this metabolically beneficial fat that's in your back, around your spine, sometimes up around your clavicles and in and around your organs. That's different than regular adipose tissue that we want to minimize. But brown fat actually is good, and it helps you metabolically. So this cold activates brown fat, also improves metabolic flexibility, of course, improves stress resilience, and can help a lot with mood and depression like we're studying here via dopamine and serotonin mechanisms. These things activate heat shock proteins. There are cold shock proteins released from the liver as well. Mitochondrial function is improved, and including kind of improved function of mitochondria, as well as biogenesis or improved signaling of mitochondrial mechanisms. We know the autonomic nervous system and parasympathetic nervous system is activated with both sauna and cold plunge, including a vagal nerve activation. We see that in heart rate variability that you can measure on your Oura Ring or in your Apple Watch or other cool health tracking devices. This is an interesting slide that just shows on the bottom x-axis magnitude of effect of sauna and certainty on the y-axis here. This looks at meta-analysis of many different research papers, and a lot of this stuff is like stuff that's easily measurable, like cardiovascular health and dementia and sleep are over on the right side. We know it's a large magnitude effect of these. On the left, stuff like pain and stress, these are a little, I think, harder to measure objectively, is why they're probably lower on the scale. But we know that sauna helps with all of these things, including all-cause mortality, sports benefits. So you see some elite athletes doing sauna and cold plunge daily, anxiety, depression. So actionable takeaways with sauna and cold plunge. What can you do to kind of get this rolling and effectively and safely? We talk about sauna therapy, aim for 20-minute sessions 4 days a week. Kind of as tolerated. Sometimes you have to build up to this. It can be kind of difficult, but that's the point. You want to do hard things, and you want to stay in there for maybe a few more minutes after the kind of difficult period sets in. But you want your heart rate up around 120 or greater. That's how you know it's working and it's stressful for you. So 4 days a week, heart rate over 120 for 20 minutes at a time. Cold exposure or cold plunge. It doesn't have to be ice cold. It doesn't have to be like breaking the ice, getting through the water, but 35 to 46 degrees is what most of the research studies look at. Tap water, cold tap water is 46 degrees typically. So you can turn your cold tap on in your bathtub and use that. You don't have to spend $5,000 or $10,000 for a home cold plunge. You can jump in the river. That can be a little dangerous, but if you're careful, that's pretty darn cold around here as well. And that's again 2 to 10 minute cold exposure. Once you start shivering in the water, you want to get out. That's when your body's trying to warm up and saying, "Hey, I've had enough." Um, Important to stay hydrated. Important to recover uh, before and after exercise and doing these difficult things. Just be smart, listen to your body. If it's painful or you're feeling more stressed or not sleeping well during sauna and cold plunge, maybe back off on the frequency or duration of these things. And then, of course, check with your primary care provider or just be smart about it if you happen to have heart disease or are on several blood pressure medicines or have uncontrolled other medical illnesses. So if you want to learn more about it, hit us up at Vail Healthspan Functional Medicine Team, and looking forward to learning more about all this with everybody together.